So again, welcome, and I'm pleased today to hand things off to our able team. So I will introduce Dr. Edie Goldbacher and Ilana Chamdi, who will lead us through today's cafe.
Thank you, Tara, for having us, and we're happy to be here. I'm going to share my screen. I see some familiar faces. So let me. Okay, can everyone see the screen okay? All right, so yes, my name is Dr. Edie Goldbacher, and I'll be doing this cafe with one of the students in our PsyD program, Ilana, who has been working with me on a dissertation that's actually related to this topic. So maybe we'll just go ahead and get started. So I wanted to start off with some questions. Probably the best way to do this, if you feel comfortable, is just to put in the chat whether you think that these statements are fact or fiction, and then we'll spend a couple minutes talking about each of them. If you don't feel comfortable putting it in the chat, that's fine too. We can just kind of read and learn. Okay, so the first is that obesity can be simplified to the concept of calories in and calories out. And I can only see 1, 2, 3, 4, 5, 6 people on my screen. So forgive me if I can't see you, if you end up raising your hand or something of the sort. And Ilana, maybe if you want to just tell me if there's anything coming in the chat.
So far we have 1, 2, 3, 4, 8 fiction.
All right, yes, so that's correct. So it's fiction. So there are, and I will also note that I have a second screen over here. So if you see me looking over here, it's because this is where I have my slides. So we know that there are many, many complex factors that contribute to obesity, and those include everything from genetic factors, a variety of different biological, metabolic factors. There's actually recent research showing even epigenetic factors. So that's the interaction between social or psychological factors and genetics, or in certain situations, you can lead to greater expression of particular genes. Lots of social factors, environmental factors, and behavioral factors, all of which contribute to weight regulation. Second, the prevalence of weight discrimination has decreased since the 1990s. These probably give themselves away, these questions, but
We have a few.
it's a fun exercise nonetheless.
Yes. We have so far 4 fiction.
Okay, so fewer people willing to kind of take a risk there. So this is also fiction. So perceived weight discrimination has increased about 2/3 from the 1990s to the 2000s. So perceived weight discrimination means when you interview or survey folks, it's the degree to which they believe that they've been discriminated against based on their weight. What about weight bias is always something that's obvious and direct. I think this one's probably also something that you could guess. So I'll just go ahead and say that's clearly fiction. So it's not always obvious, but you can, when you look, you can notice it and see it all around us. So this can be everything from the chairs in a waiting room, sensationalization of a pop star's weight loss, all the way up to very explicit and derogatory comments made toward people in larger bodies, and then things that kind of run the gamut everywhere in between. Okay, a few more. Weight bias and discrimination can begin as early as preschool. I'll just go ahead and say that the answer there is yes. And so there's actually some evidence that even preschoolers at a very young age demonstrate negative attitudes and beliefs about individuals in larger bodies. So when they're presented with figures or pictures or photos of individuals with varying body shapes and sizes, that their attitudes and beliefs are already beginning to develop at a young age. What about this one? Weight stigma and discrimination can lead to weight gain. Fact or fiction?
We have a handful of fact.
Yes. So the answer is yes. And in fact, this is counter to what you might hear people talk about casually or colloquially, that, oh, well, with just enough kind of shaming or criticism that will motivate someone to lose weight. And in fact, we know that the opposite is true. So weight criticism or stigma, teasing, bullying, discrimination lead to more stress and shame, decreased physical activity, and oftentimes lead to even further weight gain. And then this one, healthcare providers, especially those specializing in obesity-related concerns, tend to have the lowest rates of weight bias.
We have a fiction and fact. Fiction. A few fiction, one fact.
So the answer is actually fiction. So many healthcare providers, and this includes physicians, nurses, dietitians, psychologists, even clinicians who specialize in obesity-related concerns, tend to exhibit high levels of weight bias. And we'll talk a little bit more about this as we go through today's cafe. So hopefully this gives you a sense of kind of the lay of the land of the things that we'll be talking about this afternoon. I also think it's helpful to be able to start with some definitions that we're all on the same page as we're talking about some of these things. So when we use the terms, sometimes these terms are used interchangeably, but there are slightly different nuances as far as what we mean with these different terms. So weight bias refers to attitudes, beliefs, and judgments based on or about others based on their weight. For some individuals, actually many individuals, can then go on to internalize that weight bias. So that then means that, similar to other forms of bias, so bias based on race or gender identity, that a person as they hear these things and witness these things over time, they begin to internalize these beliefs, apply it to themselves, and then believe them to be true. So these biased beliefs or stereotypes about individuals of larger body sizes, that those individuals may then begin to apply them to themselves and believe them as true. Weight stigma is a little bit different. These are stereotypes or misconceptions about obesity and individuals in larger bodies. So some of the stereotypes can include things like individuals are unmotivated, unintelligent, unsuccessful, lazy, that individuals are fully to blame for their behaviors, that it's their fault, and that over time, this continues to perpetuate this weight stigma. And then weight discrimination is the act that comes from these beliefs or stereotypes. So this is when these things lead to unfair or inequitable treatment. And this can be both intentional or explicit, as well as more nuanced or subtle ways. So this can be everything from teasing to verbal harassment, physical harassment, and also thinking about in barriers to care, limitations in terms of reimbursement for care. So really anything that interferes with or leads to inequitable or unfair treatment.
So to break down the definitions even further, something that comes up a lot in the literature or in general to know is the concept of like implicit weight bias versus explicit. So within all of us as human beings, when we think about things, we have like mental shortcuts to how we think about things and perceive things. And implicit are more of these underlying, unconscious, quick attitudes that come up. And sometimes it's really hard for us to be even aware that we have these attitudes, or we may deny them. So something, an example of implicit weight bias might be if you're at the gym and you find yourself looking towards someone who's in a larger body, who's working out, and have kind of more curiosity about that, or kind of initial gut reactions that are different, that you might not want to, or might not really realize you have words to put to why that's coming up Whereas explicit weight bias is more identifiable attitudes and beliefs. So that might be being able to say that someone in a larger body you think might be lazier, that it's their fault, and like these beliefs that you can vocalize about individuals in larger bodies.
So if we shift a little bit to thinking about what contributes to weight bias, I think that the factor fiction that we started off with can give some indication of some of the factors. One of the most significant factors that contributes to weight bias is this, again, this misunderstanding and also inaccurate causal attributions of obesity and weight regulation. So there certainly is an aspect of it that is related to an individual's behavior, and that is a small part of a very large number of factors that can contribute to weight regulation. And in fact, for some individuals, behavioral factors can play very little to no role. And so this is this idea of shifting the focus on exclusively personal control as opposed to recognizing this larger collection of factors. So for example, you can look at individuals maybe who live in a lower socioeconomic neighborhood. And so maybe they have limited access to care, limited access to grocery stores. They don't have access to public transportation to get to a grocery store. And so therefore they maybe need to buy their groceries at a corner store. And what's available at a corner store are shelf-stable options, and the least expensive shelf-stable options also happen to be less nutritionally dense and less nutritional. And so therefore, over time, because of the limitations in access and because of, say, limitations related to food insecurity, the types and amount of food that they can purchase do not meet their nutritional needs. And so it's not that their weight change is a function of their behaviors, but it's a function of the choices that they've been presented with. So that's one example. We also know that there are many other examples of factors that contribute. So we know that things like sleep deprivation, there are lots of medications that affect weight regulation and weight control, age and hormonal regulation. Marketing is something that I think is not talked about a lot, and Ilana will talk a little bit more about that, but certainly the marketing of different types of foods can play a role in weight bias. We also know that weight discrimination actually can play a role in weight regulation and in obesity. And then this process of learned behavior. So over time, there's certain behaviors or information that people have learned and have developed over time, as opposed to these simple choices that individuals are making. So really kind of taking this step back as opposed to these inaccurate perceptions of what leads to obesity, and that then leads to weight bias, beginning to shift our understanding can then help reduce weight bias. The next category is societal messages. So these are things like that individuals in larger bodies, as I was saying before, are at fault. There's also the thin ideal. So you all, I'm sure, are aware of what typical images look like when you look at media or at models, movies, and just kind of continuing to perpetuate what this thin ideal is. We talked a little bit about environmental factors and accesses to resources and also access to care. So if a person does want to change their eating behaviors, or if eating behaviors are a part of it, or let's say they have an unregulated medical condition that contributes to weight gain, limited access to care can then interfere with the person's ability to effectively manage their weight. Individual beliefs and behaviors also will contribute to weight bias. So as Ilana was talking about before, an individual's own implicit and explicit weight-related beliefs can then perpetuate weight stigma. And then the media certainly plays a role in the degree to which individuals are exposed to stigmatizing images.
So given, everything we were discussing, I compiled some images that I wanted to more interactively kind of see, pulling them up, what thoughts come up for folks, what's kind of the messaging, how they feel like this might play in. And you can either unmute yourself and speak or write in the chat, or we know this is a sensitive topic. So if you want to direct message, Dr. Goldbacher or myself will monitor the chat as well. So when I Googled gym advertisements, these are a few images that came up.
Sorry, I'm smiling at your pair because last night, in a totally unrelated thing, right, on Facebook, there was a typical body shape of women versus typical body shape of men, and the typical body shape of women is a pear shape. So it's kind of hard to take a look at. It's no shape for a girl, both gender-wise, age-wise, and biologically, if at least there's some body of research out there that says indeed that is a typical body shape of women.
Yeah, I think that's a great point. I remember growing up, like magazine articles being like, if you have an apple-shaped body, this is the exercises to do, or a pear-shaped, and it very much like, I always found it now looking back interesting that we're using fruit even to discuss body shapes and sizes, and then the messaging that goes along with that. I see a lot of people in the chat.
Oh, sorry, I couldn't,
No,
it
no,
didn't
no.
come up.
No, totally fine.
Here, I see it now. Okay, so I can read this. So we have, wow, this is horrifying. The no excuses is very unforgiving. I also find the girl label frustrating and annoying. They are targeting women. High emphasis on forcing people to cater to a specific body shape rather than a body shape they are more comfortable in.
Did you say you wanted us to just speak up if we wanted to?
Yeah, please.
I'm looking a little rough right now, but I'm Liz Emery. I'm from the nutrition program. And so, you know, we try to teach our students about this, but in regard to this slide in particular, it's horrifying, but one of the ones, I think the one that disturbs me the most is the one for the hot yoga. I mean, granted, it's hot yoga, so they have the thing about melting, but like the body integrity, it's just, I find that really disturbing that they portray, you know, coming from a medical background, having your body falling apart, not a good thing, you know, and I just can't believe they portray that as something positive. It's
Yeah, I agree. I also found the messaging, what struck me was almost like this idea of like, there's a skinny person inside.
yeah, right.
Come work out and
There's something wrong with
or
you.
something. Right. Yeah. Like
yeah.
I also found that really, there's a lot of nuance to an image that's, I think, meant to like attract people to come, but
So I'm asking this question to Liz as well as Ilana and Edie and anybody else who wants to chime in who knows more than I. But my experience is all experiential in terms of losing weight, gaining weight, losing weight, gaining weight. And the most helpful thing that I was ever taught by a medical person was that simply working out is not a necessary and or necessarily helpful way to convey to people, particularly people who are struggling with their weight, that if you work out enough, you will lose weight, right? It helps you maintain weight when you have lost it. It's terribly important, as I understand it, at that point, and it's always good health-wise, right, to have exercise. But this whole notion that working out, right, like various TV shows have shown us, right, is what should be done is damaging. Because when it doesn't work, people get amazingly frustrated.
Yeah, absolutely. I think, go ahead, Liz, were you going to say something?
Oh, no, I mean, no, I agree. I mean, I think you have to meet people where they are. There is some data, you know, backing up how much physical activity people need to be healthy, and, you know, how much you need to lose weight and keep weight off if that is something that, you know, you desire, or like, you know, not everybody's successful with it. I don't even know if successful is the right word. You know, not everybody's able to really make that big change, but you know, so we do need physical activity, but it's not the, you know, it's got to be part of the whole package. And I think it's important for people to focus on healthy habits, not just, you know, the number on the scale. It's like, okay, if you, it's kind of like when we tell students, you know, students are like, oh, I have to have that A, I've got to have the A. Well, you know, stop worrying about your grade and get out your books and study. And guess what? You know, you're going to get the best grade you can get. So it's kind of the same thing. Like, let's just work on having healthy habits and, you know, eating good food and moving, as opposed to like, you must do this in order to achieve this.
Yeah, and I think the other thing that can, I agree. And I think the other thing that can happen, like you were saying, Margie, is when it does a couple things. One, it can set up this cycle that Ilana will talk a little bit more about, but it can set up this cycle where if you are only exercising for weight, then you get this myopic focus on why am I exercising and what does it mean? And then if there's not that connection there, which for many people for weight loss, there isn't, it is oftentimes where you see it for the management, then there's more shame and guilt and more isolation and less engagement in physical activity. So it often backfires. So being able to focus on the physical activity, the benefits for overall health, like you were talking about, Liz, and also we know for mood, there's a lot of evidence in the benefits of exercise for mood and lots of other things, and just kind of pulling away the focus from the weight and the number and the body size and more toward these other things for a lot of these health behaviors is what actually helps people make the changes as opposed to interfering with them.
Yeah, and I think also in the chat, Kelly put, weight is often framed as a character issue, particularly as a weakness. It sets up a mindset that people deserve to be victims of bullying and harassment. And I think that also ties into this point, because when people, like Dr. Goldbacher was noting, work out specifically for the weight loss, and that's the messaging they're getting from the gyms clearly, and so on. It feels like a personal weakness too, when they don't see the number on the scale change, even if health, let's say, is getting better. And that's where they might give up because they feel like it's a personal attribute that something's wrong with them, which we'll definitely get into more as well.
It reminds me of, as I was preparing for this cafe, I was looking through different videos, and I found this training video for medical professionals, and it starts off with a physician, a mother who brings her son to the physician, and the son had, I think, fallen and broken his arm. And the physician comes in and asks a couple questions and says something like, well, you know what? It's your fault. You weren't being careful enough. You fell, you broke your arm. And so I have no sympathy for you. And then the person pauses and says, so how can we take this where a doctor comes in and says, it's your fault, you broke your arm, therefore I have no sympathy, it's your problem, and then apply that to weight? It's this kind of same idea. Would you ever say that to a child who broke their arm? No, I'm not going to treat you. I'm not going to help you because you weren't careful and you fell down and broke your arm. All right, I'll go on to the next one, Elena. I mean, Ilana, sorry.
Yeah. We have a few, I know, in terms of time. I'm not sure if it would be more helpful for me to kind of point out some things or continue it to be more interactive.
What would you, maybe whichever slides you would like to emphasize more or less,
Yeah.
I guess.
So I'll quickly note this one, and then I think the media one we can keep a bit more conversational. So thinking just about with marketing, as we were talking about earlier, keeping things really noting where there's kind of like this, using the word skinny to discuss like this being better, the whole guilt-free goodness idea. Even in the skinny whip, in the small of the S, it says guilt-free skinny whip. And it's kind of like that there's shame or you should feel guilt for eating certain things. And other foods are glorified because they're called skinny or light. And how that then translates to how we're viewing individuals for their food choices, or even that we're labeling skinny as good and full fat as not good, or, you know, a sinful indulgence or whatever, using that language. And
you can just say next slide when you want me to keep
next
going.
slide. So then the media one, I wanted to kind of give space for people to notice, you know, what's coming up for them, what their thoughts are about this, was kind of the messaging that they're picking up on.
And I will monitor the chat this time. I teach media gender persuasion in these images, sell magazines. They feed, yeah, pardon the pun, right into the insecurities we've cultivated elsewhere. Absolutely. Yep. The picture that says me in quarantine, I found it offensive. Yes. We could have an entire explore or cafe about Barbie too. So
I am just to add on to that. Sometimes when I teach cognitive dissonance theory, more with the graduate students because they get it more, this idea that I'm not sure that the weight loss industry really wants us to be successful, because then they run out of products. So it is kind of this, you know, by having the skinny pop and so forth, it might reinforce like snacking instead of more healthful choices overall, et cetera. But then how would they sell other diet plans or products? I don't know. So it's this really interesting, maybe that's too conspiratorial, but.
no, I think I agree. I mean, I think that goes back to what we were talking about with respect to marketing, maintaining and sustaining weight bias and weight stigma, because it sustains their profits. A lot of pressure put on people to be a certain size. I notice a lot of celebs, particularly women, are criticized if they gain weight.
There's no way that those models aren't like airbrushed. So
Yeah, that's definitely not.
Yeah.
Even my Zoom filter isn't that good. So
Anything else? Or Ilana, was there anything else before I move on to the
I
next
just
one?
always, you know, I noticed like it comes up magazines everywhere, the whole like bikini body, or this concept of like Tyra Banks fighting back against you know, that it's so ingrained, like the messaging everywhere is showing kind of the negative, or like someone noted in the chat, Rico noted the offensiveness, like it's offensive to be in a larger body, and kind of what's the underlying message that folks who are in larger bodies, like how they're perceiving people in larger bodies, but also individuals who are in larger bodies, how they're perceiving themselves based off of this messaging. And then I think we can move on to the next slide. And this part I'll go through quickly, but just noticing day to day what individuals in larger bodies and all of us are encountering and the subtle messages there. Thinking about the classroom chairs when we were back in person, but that they don't accommodate and fit individuals in larger bodies easily or not comfortably. A doctor's office, that when there's a chair with arms, that's already kind of making something inaccessible or uncomfortable. Turnstiles at a subway, like all these kind of like day-to-day things that we don't really think about. If we're in, average or smaller bodies, and even mannequins, but in general, going to a store and being able to pick something up and have it fit is kind of a privilege of being in an average sized or normal sized body that we don't think about, but how it impacts individuals in larger bodies.
I see some information in the chat. Eileen says one of my students pointed out just last week that we have both these skinny ideals blasted at us, but also this love your body and body positivity campaign concurrently, confusing opposite themes. And then someone else said, yes, I agree.
Yeah, I think to that point, it's been interesting because if you follow on social media accounts of individuals in larger bodies, they note that a lot of the love your body and body positivity has been kind of overtaken by individuals in normal and average size, smaller size bodies who will bend and contort and show rolls in their body and be like, see, my body's still lovable. And it's not as centered about individuals that are still in more marginalized bodies. So even the focus there has been shifted. So it is interesting to think about. Okay, should we do the poll?
Yes. So Tara, do you mind doing the poll? Thank you. So this is anonymous. And if everyone can take a minute to answer and then the responses, I think Tara, you can share the responses after they come through.
I'll wait just a minute or two to allow it to late.
Yep.
Approximately 50% of folks have voted. We'll take another minute or two, a few more seconds.
Sure. And I don't know if you can you share the poll while I'm still screen sharing? Can you share the results?
I'm going to try. So let's,
okay.
And if it doesn't work, we'll redo. All right, so about 85% of people have voted now. So I'm going to give about 4 more seconds in case there's one more of you out there. And I'm going to close. All right, are you able to see the results?
Yes.
Great.
Great. Thank you very much. Okay, so let's just take a quick look at these. So the first one is I myself or someone close to me has been the victim of weight bias. Sorry about that. So 84% said true for that one. I have seen others say or do discriminatory things to people in larger bodies. That's 95%. I have seen or experienced weight bias in a health setting, 68%. I've seen or experienced weight bias in the classroom, 68%. I've seen or experienced weight bias in the workplace, 63%. I have seen or experienced weight bias from family, 84%. And I've seen her experience weight bias from friends, 68%. So this is pretty consistent with what we're talking about. And in fact, these percentages pretty closely map on to data that have been collected. So if you look at the slide, about 55% of adults with obesity have experienced weight prejudice from coworkers, about 70% from healthcare workers. So just sit with that for a minute, where you're going to the physician to get medical treatment that you need. And a large percentage of folks who are going are experiencing some sort of discrimination. And oftentimes that interferes with their desire or ability to return and get the medical care that they need. School-age children affected by obesity are about 60% more likely to be bullied, and about 70% of media images stigmatize individuals affected by obesity. So again, really highlighting that this is a very prevalent, problematic issue. Weight discrimination was rated as the 4th most prevalent form of discrimination. Did I jump and take from you, Ilana, the slide that you were going to do? I'm sorry.
No.
Okay. So this was just after race, gender, and age, although age was tied pretty closely with weight discrimination for women.
So to discuss kind of why does it matter? Why are we kind of talking about it and thinking about this? Earlier, we noted the concept of weight bias internalization. So when folks in larger bodies start to internalize these beliefs about themselves, and there's, like Dr. Goldbacher was just noting, it impacts so many areas of their life. In part, they are being discriminated against in settings like schools, the workplace, but also in terms of the psychological impact, they start to have lower self-esteem, feel shame for their body size, and higher rates of depression and anxiety. And an example of something like that might be like anxiety doing something that a lot of folks do without thinking about, like going into a store, a clothing store, to try and find something, going into a restaurant and feeling judged, and how this like continues on, and the psychological impact in part goes hand in hand a bit with the social impact. So individuals in larger bodies, there's less social support, lower rates of intimacy, and oftentimes family members, friends, spouses, individuals that are close to them are perpetrators of weight bias. Thinking about messaging you're getting from that group of people you're looking towards for support and for validation, and kind of being shamed or told something's wrong with you on kind of a pretty consistent and regular level, and how this then in turn impacts physical health. So oftentimes to cope, there's a lot of like eating into foods that are less nutrient dense, or engaging in binge eating behaviors to cope with some of the psychological impacts. And also noting like shame going to the gym or exercising, feeling kind of like you stick out, or that's not a setting that is appropriate for you, or being targeted. So then feeling less likely to engage in physical activity. And as we were noting earlier in our conversation, also, even when engaging in physical activity, when it's so weight focused, if there isn't kind of an immediate result, or even if the result isn't quite as drastic, let's say, there might be kind of a feeling of shame that something's wrong with their individual body. Why aren't all these diets that claim you'll lose 70 pounds in 3 weeks, working for me? And this cycle of like, you'll see a lot of weight lability, like weight up and down, which isn't great for health of that individual either. And then in turn too, as we noted in the fact or fiction, that oftentimes doctors perpetrate that weight bias. So when they even have the kind of momentum to go and take care of their health and even go to a regular primary care physician. If they're receiving these negative messages, they're less likely to continue to go for care. And thinking about too, oftentimes, I don't know if anyone's had this experience, but if they go, let's say, to an urgent care for flu-like symptoms or something else, and then they're being kind of told and talked about their weight and weight management when they came for feeling sick and having the flu, you know, putting that kind of that moment of weight bias of the doctor treating them differently in that moment, again, makes them less likely to seek resources and help from medical professionals, which all kind of play into continued risk for weight gain. And in part two, the stress, the mental health piece of it increases cortisol, which is a hormone that impacts weight gain as well. So in that sense, it's kind of like the everything stacked against these individuals, and then they're kind of receiving messaging that something's wrong with them and that there's something that it's their fault, where when you kind of pull it all apart, it's so complicated and nuanced and cyclical in nature of how the physical health impacts the mental health and messaging and so on.
The only other two things I'll say here, we haven't really talked much about this here, but there is a link between weight bias and weight stigma and eating disorder risk as well, both in terms of binge eating and also risk of triggering an underlying predisposition for eating disorders. So anecdotally, both Ilana and I think Ilana, this has come up for you too, when we've worked with, so my area of expertise is working with individuals with eating and weight-related concerns. And I've worked with people even recently within the past 2 years where the trigger of their eating disorder onset was a physician saying, well, now you are obese, and so you have to do something about it. So it's not necessarily going to cause that to happen, but is certainly a risk factor, particularly for people with that underlying predisposition and people who are already particularly sensitive to body image and body dissatisfaction.
Yeah.
And then go ahead.
I want to piggyback off that point too, that I know I mentioned binge eating as an example, but it's kind of it can, like Dr. Goldbacher note, kind of trigger and impact a lot of disordered eating, but a lot of times something like anorexia type restriction will be overlooked when individuals are in larger bodies and so on. So even more so, the concerns surrounding, like, not even just overlooked, sometimes praised. So thinking about kind of that ripple effect.
Yes, without getting too much into this psychology piece, there is, we are, as a field, I think, are getting a better understanding of folks with what we call atypical anorexia. So these are folks whose body weight doesn't necessarily fall in a dangerously low range, and yet the behaviors and the cognitions and the experiences that they're having are dangerous and are consistent with anorexia. And because of this weight bias, there are many, many health providers who overlook, and as Ilana said, sometimes reinforce these behaviors, which becomes very problematic and dangerous.
I think one of the things that I'm hearing the two of you say that has always bothered me tremendously is the notion that a failure in this area of life, some label of failure, makes some people assume that folks lack discipline.
Absolutely. I mean, absolutely, that's a false belief. Yes.
Right. And so I am the most disciplined person I know, right? In every aspect of my life, right? In terms of what I do when I get up in the morning, how I wrote my dissertation, the way I prepare for my classes, and the way that I have dealt with my weight issues over the years. And when people hear my story, if they take the time to hear it, oh my God, you mean you lost over 100 pounds 5 times, right? That you did this, that, and the other thing. They say, how did you do? Because I'm amazingly disciplined, right? Totally disciplined. But being disciplined or not believing that you're disciplined when you are can cause the anorexia that you're talking about. It can cause the binge order. It can cause the ups and downs, and it can cause other kinds of, quote, failures in your life way beyond eating, right? And so for me, the most dangerous thing that healthcare providers mistake, right, in doing this is saying, and I've forgotten who wrote it in the chat, but this notion that, well, you have to make choices. You have to make better choices.
Mhm.
Most of us with these problems have been making choices,
Mhm.
good choices, for the majority of our lives, right? Not all the time, obviously, no one does all the time, right? And that infuriates me because it causes so much more harm.
Mhm.
The notion that if people have a problem with their weight, it's because they are not disciplined.
Yeah.
I'll put my discipline against anybody. That's not, the cause of my difficulties.
Absolutely. And well, go ahead, Ilana. You look like you want to say something.
I think to that point, I kind of think about the whole concept of like doctors, even from a young age, labeling it as a weight problem when talking about kids' weight or adults. And this idea of like, there's this whole concept of health at every size. Like an individual could be at a higher weight, but very healthy. And that's kind of a set good weight for them. But that oftentimes doctors are kind of already jumping in, like, how are we going to manage this? What choices are you making before saying like, what's your lifestyle look like? What's your labs looking like? And if they're kind of talking about engaging in a healthy lifestyle and their labs are coming up well, but that's not typically the approach. More often than not, like you noted, they come at it like, well, what are you doing that's causing you to be at this weight? That's not great. Let me provide like a sheet about diet and exercise and the warnings of like, if you don't do anything about this, here are all the problems that are going to come up for you health wise. And I'm just trying to intervene when it's not that straightforward.
And I think as well, this idea of discipline, we could have a whole other conversation around it, because you're right, discipline for many can lead to rigidity, and that rigidity and inflexibility is then where you see the risk for eating disorders. I see the chat, I just opened it back up and see some comments. So one shared, despite telling my family physician I had sought treatment for binge eating disorder resulting from childhood trauma, his advice to manage my diabetes was losing weight comes down to choices. You need to learn to close your mouth. I recommend Jenny Craig. I'm sorry to hear that, but thank you for sharing that. That's horrible. Right. And I mean, people just don't realize these things that are coming up in day-to-day life in interactions with professionals. So Aline acknowledged, I wonder if there's a sex gender difference in how healthcare providers address this. Would a female physician be as insensitive to the root causes of BED? Interesting question. I find it has more to do with the age of the physician. I think younger doctors are generally more aware of the dangers of weight stigma. Perhaps medical training is better now. I think from my experience is that there are some improvements in medical training, and some of the research is actually quite new. And some of the research on trainees is also quite new. And actually this is exactly what Ilana is looking at in her dissertation, except she's looking at it in relation to doctoral psychology trainees. So I don't know if you have a couple of words you want to say about that, and then we can move on to the
Yeah, I
last
think
piece.
that to the point, the whole concept of doing weight bias training in general is kind of a change we're seeing.
Mhm.
The literature is a bit mixed. Unfortunately, there isn't kind of a gender difference showing that like females might be more sensitive or really often targeted by the messaging and internalize it as well. Do I think some med schools, programs in general, healthcare programs are trying to talk about this? Yes, I think that's promising. The long-term effects are kind of unclear because there's always kind of a quick, like 1 month follow-up, 3-month follow-up. It would be interesting to see in practice how this looks, because all the studies looking at clinicians and doctors in practice are not super positive at this juncture.
There are some recent interventions, and on the reference page that I put at the end, the Rudd Food Center has excellent resources, and they've also developed some weight bias intervention training for medical professionals.
It probably is worth just saying, though, as an older person here, I'm 70 now, it is still critically important for healthcare professionals to work with people on issues that ultimately may be harmful for them. The question is how to do it, and to do it in a positive way. So I absolutely do not believe that doctors should be taught to stay away from this topic. I think it is a critical topic. I wish that my doctors had been better trained, right, all the way through my life to have helped me in a more positive way. So it's not an issue that you're healthy at any weight, or if your numbers in your blood are good now, they will remain good. They may not, right? I mean, I'm a diabetic in remission, thank God. I never knew such a thing was possible. My doctor now tells me the literature says it's possible, and it is related to weight loss, right? It is extremely both possible and a good thing. The question is, how do you do it?
Absolutely. And I think the idea is that what is starting to shift is the idea of a physician imposing this on someone when they are not ready, or doing it in an insensitive way, or avoiding it altogether. So when you get, like you're saying, more comfort and knowledge and understanding, and you give the choice and the power back to the patient, and then give the physician the skill, or dietitian, or nurse practitioner, or psychologist, or whomever the medical or healthcare provider is, the skill to be able to have these conversations effectively, and then how to help the person effectively make those changes when they want to, or help them explore and come to that decision on their own. That's the piece where the shift happens. Yeah. So this is actually a good segue into these last few things that we wanted to bring up, which are just some thoughts of both for everyone here to consider, as well as some potential next steps or action steps, and then some resources. So one option, one possibility, or one good step is for everyone to just ask yourself some questions. And this is actually adapted from one of those guidelines that I was talking about. So some of these questions, you don't have to ask and answer them now, but I encourage you to ask yourself these, and ask others to ask themselves these questions. So reflecting on how you think about the causes of obesity, and whether that affects the attitudes toward and treatment of individuals in larger bodies. Do you currently, or have you believed any of these common stereotypes that we've just talked about, and that Margie and others have described? Do you make assumptions about an individual's character, just as Margie was saying, based on capabilities or qualities based only on their body size or their weight? Another thing is attend to how you talk about your weight or other people's weights in your social circles. So there's this concept, I don't know if any of you have heard of this idea of fat talk. But it's kind of a fancy term for what typically girls and women will engage in, which is, oh, does this make me look fat? If I put this on, do I look fat? Do I look too big? Does this make my stomach look fat? Does it make my thighs look fat? I look fat here. It's really common, just kind of everyday occurrence that typically girls will engage in with other girls or women with other women. That type of fat talk perpetuates weight stigma and weight bias. So something very simple that if you hear it or if you are doing it, to kind of catch yourself and change the way you're talking about that. Social media, what do you post? What do you like? What do you promote? What do you repost? And how is that also potentially contributing to weight stigma? What language are you using? So now the term fat for some individuals in larger bodies has been reclaimed. So you'll hear people talking about I'm fat and I'm proud, or kind of being pride in using the term fat and the word fat. And I think that's also, if it's someone using that to describe themselves in that way, then that carries a very different sense than if you're using that to label someone. So these are some suggestions for other words that you could use, or if you're in a situation where you don't have to talk about weight. So oftentimes things like larger bodies or higher weight, BMI, which is also problematic in and of itself, but within particular context can be helpful. People with obesity, so using person first or person-centered language. So it's the person describing, you're identifying the person before the condition. Or if you're not a medical professional, you're not talking with this person, you're just meeting a person on the street, don't be talking about, or friends or family members, don't be talking about their weight at all. It's not necessary to comment on your friend or your family member's child who seems to have lost weight. I see a comment in the comment box. It's important to speak up in a productive way. My friend's daughter is 14 and swims and runs. The track coach just told her that she won't train with 2 other girls because, as you obviously see, your body is different than theirs. The mom wondered how to bring this up, and I encouraged her to be forthcoming and use language about skills, not bodies. Excellent. Yep. And that's actually in one of these next points that I make here, which is to make sure we as individuals can take responsibility for challenging people, both directly and also, interestingly, one of this bottom link that I have here, the Obesity Action Network actually has a place where you can report media that you think is perpetuating weight stigma and weight bias, which I didn't realize. But doing things like examining at your institution or your child's school, are individuals in larger bodies protected in terms of weight discrimination? There are no federal laws, and only one state, Michigan, has a law in place that protects people against weight bias and weight discrimination. Thinking about facilitating discussions of weight stigma in your classrooms, and particularly when you're training student professionals. So in this IB program, we talk about this as part of our conversations. It's, I think, more common to talk about race and gender, culture, and it's equally as important to talk about weight stigma and weight bias. And then there are things that you can do. So there are things like if you have a waiting room. So we in this ID program have a clinic. And when I first came here, I made sure that we had chairs that were placed in the clinic with no arms. So kind of reevaluating, what does your space look like and what messages is that giving? And that's it. This is a list of potential resources. For those of you who are not familiar with the IAT, it's a possible way to also facilitate self-exploration or conversations with students, colleagues, coworkers about a variety of different forms of implicit bias, including weight. The Yukon Rudd Center is the one that I was telling you about. So Rebecca Paul is a psychologist who's done a lifetime of work related to weight stigma and weight bias, and does a lot of trainings with a variety of different people across the world. There are a couple of video archives, and then we also, Ethna put together a really wonderful LibGuide that has the more specific resources, as well as additional references and other things that you can go to for more information. And that's it. Thank you all very much. I know we're kind of out of time, so I don't know if people, I guess, have questions or other things that you want to talk about. We can stick around, or I can stick around for a few minutes, and you're also more than welcome to email me if there's anything else that you'd like to bring up.